Hey guys, Kirk here with Premier Chiropractic. So today I just want to touch on hip flexor tightness and the connection that it can have with hip arthritis. So we know that tight hip flexors can lead to a bunch of issues functionally. Specifically, the more they get tight, the more we tend to see forward tilt of the pelvis. Now, the connection to the hip is a little less understood. So there was a paper that came out and it basically looked at, we're going to talk about the hip flexors as the iliopsoas, although there are more than that. But specifically, the iliopsoas comes from the lumbar spine, comes down into the kind of this bowl of the pelvis, and then down into the femur. So when you have tightness in this muscle, you can imagine it's going to create some pressure in the hip because it's going to be pulling it up. And that's what they found with this paper, because it's hard to determine pain sometimes. So especially with hip arthritis, there can be people that have really bad hip arthritis with no pain, and then people that have very mild hip arthritis with tremendous amounts of pain. And the thing they found in this paper was that increased pressure in the hip joint is what actually led to the increase in pain. So how would you get increase in pressure? Well, you can get it. Basically, they found the losses of range of motion in the hip with this paper were extension and internal rotation. So those are the two ranges that will increase pressure in this hip the most. So if you can imagine, we got that tight hip flexor, it's compressing here, right? And then it's going to restrict those ranges of motion through this hip. So what we like to do with people with hip arthritis is keep it moving. We're going to assess what ranges of motion you're going to be lacking. And I would say that paper correlates really well with what we find clinically, and that people usually lack extension in the hip and internal rotation in the hip, and then sometimes external rotation in the hip as well. But that extension, internal rotation is a pretty common one with hip arthritis. So that doesn't mean, what they also found in the paper, something that was kind of cool, was when they had an injection in there to kind of calm down those muscles, essentially that full range of motion was back. So that tells us it's coming from the muscles and the soft tissues, and it's not coming from the capsule itself. So basically, with our rehab thought process, we always try to gain back the ranges of motion that you're missing. So for someone with hip arthritis that would be lacking maybe an extension, we would work on loosening up those hip flexors, because that can be a big limiter to your progress of getting pain-free.